Alright, we are recording live for blackmentalhealthnet.com. Today we are with Dr. Treniece Lewis Harris. And so to start off, would you mind introducing yourself for us?
Yes, my name is Dr. Treniece Lewis Harris, and I'm an assistant clinical professor of psychology at Harvard Medical School, and I head our diversity task force here at the Cambridge Health Alliance.
Excellent. So the first question that we have for you is how do culture and race factor into mental health and well-being?
Well, first of all, culture provides a foundation for our personal identity. Our upbringing is very much influenced by culture and all that it entails, whether it is our ethnic identity, our racial identity, how we define what it means to be a, quote, real man or real woman. It all provides a context for how we see ourselves. And it also influences the way that we view normality. Our cultural values really influence what we see as normal, what we see as illness, and how we really define well-being. In the Black community, a lot of the strengths of our community, whether it be strong families, strong extended families, a real sense of diverse spirituality and social justice, are things that really promote well-being within the African American community, especially within the context of intergenerational and ongoing stressors like economic issues, poverty, institutional, and even blatant racism.
Alright, now what makes mental health different, or why is mental health discussed differently in the Black community?
Well, one thing I would say is a recognition that the Black community itself is very diverse. We have many different ethnic groups that make up the Black community. We are wide in scope in terms of the economic status of our community members. We are multilingual, and we have many different values, albeit many shared values. And so the way that we talk about well-being and mental health varies as we compare ourselves to some of the other mainstream groups within the United States, but can also differ within the Black community itself. And depending upon our individual values and those of our specific within cultural groups, that can really influence the way that we think about our health. It really influences whether we decide we have an emotional or serious mental health problem. And we can really take three different members of the African American community raised in three different cultural communities with similar symptoms, who come up with similar explanations as to whether they have an emotional problem or not. If we take anxiety, one person may see their anxiety symptoms as a sign of weakness and will therefore try to solve the problem by relying on themselves and trying to, quote, be stronger in their character. Another person might see their anxiety symptoms as a spiritual problem, and their first line really of support, or their first stop in help seeking, might be with a spiritual leader, a pastor, or a minister who might pray with them, who might suggest some particular healing practices. And another person might see their anxiety symptoms as a medical problem, and they're likely to show up in an ER or to make frequent visits with their primary care physician. So that often, by the time someone is referred to a mental health professional, they have tried lots of other things or are continuing to have other kinds of help-seeking behavior before they take on some of the suggestions or ways of thinking that we might present to them. And those are important, to know that the way that we think about mental health differs, and that it changes when we seek a mental health professional, and it changes at what point in their symptomatology a mental health professional may see them for the first time.
Okay, now how have mental health professionals done when it comes to addressing cultural and racial issues in mental health?
Well, we've come a long way, but we still have quite a bit of the path to travel. Historically, the theories of personality and pathology within mental health were defined using the worldviews of European Americans. And as a result, when Black Americans historically sought help within the professional mental health community, they were sometimes misdiagnosed or underdiagnosed. Misdiagnosed in terms of having many of our cultural norms pathologized, and some of the real stressors that African Americans have experienced within the U.S. were sometimes pathologized as paranoia or some sort of delusion, or misdiagnosed in terms of not really acknowledging the degree of stress and trauma that has been experienced by institutional racism. But I will say that we've made quite a few gains. In the last 50 years, we have paid more attention to multicultural views of health, of well-being, and in incorporating real-life stressors and their impact on emotional well-being. And our new generation of mental health professionals within psychiatry, psychology, social work, psychiatric nursing are folks who are really encouraged to think about their own worldviews, to think about their own values, and the way that these factors impact patient care. And there is also a larger movement within training programs to consider social justice issues and the way that they impact well-being. Our clinical services in more contemporary times are not only located in hospital settings, but are really focused on trying to create more outreach, and so that there are more community mental health centers, and there are increasingly more partnerships with community organizations and even in-home based services that increase access to care for members of our community. I hope that in the future that we will have more attention paid to reducing the stigma. I think that amongst our community there's still a large stigma about what it means to have an emotional or serious mental illness as compared to having a serious physical illness, and as a result we often still have many healthcare disparities because we're less likely to seek formal psychiatric care even when it is needed.
Okay. Now, how does mental health awareness compare to awareness of other issues within the Black community?
Well, I think we are fully aware of so many of the emotional problems and stressors and challenges that we have across our communities. So many of us will describe one or another family or friend who's been too depressed for too long or too worried for too long, and we certainly worry about some of the less functional ways that people try to deal with emotional stress, using the example of substance abuse or alcohol abuse. So there's definitely a great awareness that emotional problems are something that we struggle with. I think we're less aware of the formal definitions that mental health professionals may use to describe some of the emotional problems that the community discusses on a lay basis. And so I think that we can do better as a mental health community in describing some of the ways that we view problems and really partner that up with some of the community discourse about emotional health and well-being.
Now, how could someone go about seeking help if they needed it?
Well, access to care is very accessible in a lot of different ways. One easy way could be to contact one's insurer and get the name of a professional that is in your area. Some insurance companies do provide demographic information for mental health professionals. So if you're looking for someone who shares your religion or your ethnicity or even racial background, sometimes that's information that can be gathered. Another route for seeking services may be through one's primary care physician. Some of the great partnerships that happen within communities are mental health professionals and primary care physicians really keeping awareness with one another about services and to mutual referrals. Another area that I think is an area of growth really is seeking out a referral through community agencies. Some of the outreach that I think that we can do as a professional community is to provide greater awareness to political organizations, to service organizations, to community organizations, because often these are some of the places that our community goes when there is a problem and when they are emotionally affected by those problems, but there's a credibility and a trust issue that sometimes occurs between the professional mental health community and the Black community. And the degree that we can gain more trust and credibility within these different community organizations, the more we may get first-line referrals and have members stay within treatment rather than ending early on due to concerns that they will not be adequately heard. And then I also think that another way to seek referrals is through someone that you might know who has seen a counselor as a first-hand referral.
Now, in your last answer, you mentioned seeking providers from different demographics. Is it mandatory that the provider comes from my personal, ethnic, or racial background?
No, I think that certainly there's an increased likelihood that you may share a similar worldview, that you may share similar values, and that that person might more easily understand the context in which the difficulties you're facing are shaped. But it's not a guarantee. I think also that any mental health professional who listens to the issues that you're facing within a cultural framework, who respects your worldviews, who inquires about the way that you view your problems and the context in which they are experienced, one who acknowledges even the historical dilemmas that the Black community has had with health institutions generally and with mental health institutions specifically, might make it easier really to establish a bond. And I think that if a collaborative approach to understanding the problem and a collaborative approach to establishing what the plan for treatment will be, I think that will increase the likelihood that whomever you see will be able to help you effectively.
Now, what does it say about me if I seek help for mental issues or unrest?
I think it really depends on what we mentioned a little earlier about your explanation of the problem. Someone who sees having depression, for example, as a sign of weakness might avoid going to see a mental health professional as a sign that somehow it's confirmation of that. But in that example, it's a sign really of strength of knowing that you can really incorporate the help of others in strengthening yourself in that example. Another person might worry about going to see a mental health professional if they have a spiritual explanation of their problems and see it as somehow not trusting their God or their higher power in solving their problems. But one might view it as a way in which God or that person or that being that you look to as providing a mental health professional in your life, as a source of support. So I think it's important for us as mental health professionals to really inquire about the nature in which the person views their problems so that we can help them feel good about seeking help when needed.
Excellent. Thank you so much for your time, Dr. Harris, and we're signing off from blackmentalhealthnet.com.